So simple as GIT people, whenever we want to give something capsaicin, we'll think of some we'll call diarrhea, but I think this is also manageable nowadays. So one thing I think this is a one I think when enzyme this DPYD gene actually, okay, DPD enzyme, which is very useful in 5FU metabolism. If this deficiency happens in this one, I think people suddenly they develop so many complications, mucositis, bone marrow suppression, dermatitis, ultimately suddenly they may die also. So problem here is I think this the incidence of the DPD, some of the deficiency very minimal, but still in European countries they say before you want to give the explain to the patient, if the patient is willing to go for the testing, do the testing. But in our country we are not doing that one at this point of time. Only for research purpose we do that one. And at the same time this simply they'll divide the whenever you want to do the test, I think you can do that one. In normal type you can give the full dose. If something in a heterozygous, we can say only 50% dose you can give this, and there's a moderate metabolizers. The third one is I think poor metabolizers, better not to administer 5FU in these poor metabolizers. So toxicity is important. Only thing is we should be very careful at the time of counseling a patient. They should know what are the complications, when to report to us. And ultimately this what is this acute toxicity we discussed just now. Again this all the, especially this oxalpatin, whenever you are giving the oxalpatin, they may develop some laryngopharyngeal dysesthesia. Suddenly the patient are not able to talk. So whenever they want to take any cool drink also, suddenly they will have the something choking sensation. So they should avoid all those something cool and what you can say ice creams and cool drinks. And cumulative neuropathy with this sensory neuropathy, there is also, we can see that one, but it is a cumulative. So we have to ask every time what is the any symptom of a neuropathy, especially sensory neuropathy, not a motor neuropathy. So these are the symptoms of 5FU, but I have already mentioned that one. Be careful about this 5FU toxicity, especially cardiac one. And affordability, I think nowadays, these are the whatever regimens I have mentioned just now, K-Pox, Folfox, or S1X, all the regimens are affordable. It doesn't cost much. Of course, from the Red Hills to the high-tech city, it changes the cost, but still it's affordability. So don't worry about that cost of this one. It is also covered by this RGH, EHS, JHS, whatever is even Ayushman Bharat also, everything. Affordability is not a big issue in this setup, okay? So don't worry about this one. So these are government programs, Andhra, Telangana. I think one thing about we have to proudly say that this is only one state, combined Andhra Pradesh, we started a health insurance program under the government. So many people are able to get the treatment, either surgery, radiation, chemotherapy at free of cost. So now it's a role model to the whole country. Now you can see that one, even Pradhan Mantri also they started. Pradhan Mantri, Ayushman Bharat also now we have. So many health schemes are there. Affordability is not a big issue. And take home is again just tolerance and toxicity is most important. We should be very careful because these are curable malignancies. We should be very careful. And strict monitoring about this one. Every time we have to ask the patient what type of the toxicity developed. And ultimately, what I mentioned, same thing. So our Raghusaras and always they used to mention only one thing. If the patient undergone the what gastrectomy, vitamin B12 supplementation, they have to take lifelong injection. This is one I think all of we should remember as surgeons, radiation oncologists, medical oncologists, because this vitamin B12 is absorbed through the stomach. If it is not there, of course, the intrinsic factor. So try to supplement this one to avoid long-term many toxicities. So thank you for giving this opportunity, Vijay Kumar sir and organizers.